A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a bold move that has sparked significant debate, Kemi Badenoch, leader of the Conservative Party, has announced plans to legislate a ban on strikes by NHS doctors if her party regains power. This proposal comes in the wake of a 5-day strike initiated by thousands of resident doctors, formerly known as junior doctors, who are protesting against what they describe as inadequate pay. The British Medical Association, BMA, has been at the forefront of this dispute, arguing that despite a recent average pay rise of 5.4%, doctors' salaries have effectively declined by 20% since 2008 when adjusted for inflation. Badenoch's announcement on Sunday emphasizes her party's intent to introduce minimum service levels across the NHS, equating the restrictions imposed on doctors to those currently in place for police officers and armed forces personnel who are legally prohibited from striking. The Conservative Party believes that these measures are necessary to ensure the continuity of care for patients and to protect public finances. Badenoch criticized the BMA for what she termed a militant approach to negotiations, stating that the pay rise already awarded to resident doctors was generous compared to other sectors. She asserted that the government had previously offered a fair deal that balanced the needs of doctors with the interests of taxpayers. Following the strike's commencement, Health Secretary Wes Streeting has expressed that the government will not allow the BMA to hold the country to ransom and has committed to minimizing disruption within the NHS. Hospitals have been instructed to only cancel non-urgent procedures under exceptional circumstances, with reports indicating that many facilities are still able to perform a significant portion of their scheduled work. However, some patients have reported cancellations of their surgeries during the strike period. The Conservative Party's plans to reintroduce minimum service level requirements were initially set forth by the previous government, but were subsequently abandoned by Labour. Badenoch's stance aligns the UK with other countries, such as Australia and Canada, where stricter regulations on industrial action exist within the healthcare sector. The BMA, while acknowledging the recent pay increases, maintains that a further uplift of 26% is necessary to address the real-term wage decline that doctors have faced. As the strike continues, NHS England has urged patients to attend their appointments unless otherwise notified and has pledged to reschedule any cancellations as swiftly as possible. Amidst these developments, the BMA and Labour Party have been approached for comment regarding the Conservatives' proposals. The ongoing situation highlights the tension between healthcare professionals advocating for fair compensation and a government seeking to maintain essential services amidst rising industrial action. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.